All right, hello everybody. My name is Sean. I am a recent graduate of the University of Florida. Graduated with a Bachelor's of Science in Applied Physiology and Kinesiology. I did my internship here at Best Day Fitness, and I've learned a lot. I want to share a little bit of what we do with you guys in the form of a basic assessment. So every time we have a new client come in, be it any population, athlete, general individual looking for a healthy lifestyle, or even special populations, we're going to do some sort of initial assessment to give us a good idea of what their baseline is and provide them a little bit of perspective on what we're planning on doing, as well as enlighten them to the science behind what we're going to do. So as a sort of baseline, any human body is designed to function with primal movements. So what are some of the basic primal movements? You got squats, lunges, pushing, pulling, twisting, deadlifting, and then the seventh one is gait, which is just walking, running. Those are all the things that our body is designed to do from the ground up. So when we're going to do an assessment, and we'll take our brief run through here as an example with a normal healthy individual that's looking to do muscular fitness and flexibility training. The way that I'll typically run a assessment is from the ground up. So you notice we're all here barefoot. We work in a barefoot studio here. Why? The human body is designed to be barefoot. Shoes are a crutch that we've added to increase comfort in certain scenarios. But in order to truly get a grasp on the muscular fitness, we want to understand that feet are the foundation of our contact with the planet Earth. It's what holds us up. It's what moves us forward. And we need to be able to assess the strength of those muscles in the feet. Your peroneals, tibialis anterior, gastrocs, are the major muscle groups that work down there. So I would like one volunteer, please. Come on forward. And what's your name again?
Kelly.
Kelly, all right. So when I'm going to do a basic assessment, typically start with standing and posture assessment. So we looked at our skeleton picture a little bit earlier on over here. So when we're standing, you want to imagine your body having a vertical axis running from the top of your head down to the floor. And then we have several horizontal axes, shoulders running straight through, hips, knees. And then we do want from the top of the head all the way down through the shoulders and through your joints all the way down to the ankles to be along a single vertical axis. So this is where we'll typically start seeing habits starting to come uncovered from everyday life. Typical habits, slouching. Everybody slouches. Why? Everybody's on a phone. Everybody's typing on a keyboard. Everybody's writing in a book or studying. It's terrible with college students. It's what our lives are, sitting in a chair and slouch forward. So starting with posture, always looking at the scapula. Want to retract the scapula without shrugging too much on the upper traps. Upper traps are always activated, right? We're shrugging when we're texting. We're shrugging when we're writing. So we want to relax the upper traps, retract the scapula, get a good pinch right in there along the spine. Shoulders are looking in line, good with the head, chin and chest up and out. There we go, looking good. All right, so we see a good lordotic curve coming in the low back. Straight up and down on the toes. Everybody's going to have a little bit of differences when it comes to joint alignment. Some people you'll see will be a little bit more turned out, a little bit more turned in. Just find that comfortable zone to start working with. Now I ask you to feel your feet. Not everybody really has a concept of feeling their feet. How many people got monkey toes, can pick stuff up and put it down? Not everybody can do that. But just take a second and kind of grip the ground. Grip the ground, feel with your toes. That's what you're using to hold yourself up, because before long we're going to start rocking and rolling here and you're going to want to be able to balance. All right. So when we're working the toes, working those intrinsic foot muscles and your peroneals, getting a good grip. Next piece, we want to start working our way up. And this is going to vary trainer to trainer. I'm working from the ground up. Depending on the populations, you may start out on a table and start working with some more of the posterior muscles. But for, like I said, a normal, healthy, standing human being, my typical method is to work from the ground up. So the next big muscle group that we're going to be able to look at is your gastrocs, right? So how would we want to work the gastrocs? Nice solid calf raise. So come on up on your toes and come back down. Up one more time and down. All right, so we're pretty used to doing that. Every time we walk, we're going to get a good concentric contraction of the gastrocs, but how can we make that a little bit more difficult? Let's start throwing in the challenge of balance. Balance is the key to everything that we do. It's how we hold ourselves up, fight gravity. The way we can do that is ask our muscles to work isometrically, hold a nice long contraction, change our center of gravity. So a big way to assess the effectiveness, strength, and longevity of muscle is to ask you to contract in that fashion. So what I can ask you to do is come up on your toes and hold. And this is something you're going to see vary quite a bit. How long can people hold? She's looking pretty fit. I think she can hold it for a while, but not everybody can do that. All right. So when you come up, people are typically going to be, step this way a little bit. People are going to come up really high and rest on those metatarsals. So the next trick I'll ask people to do is kind of drop down about 20, 30 degrees. Drop down just a little bit. Now you're taking the balance off the bones and asking the muscle to do all the work. That's how we usually leave it here, pretty much until their muscles start to hurt and start to see, looking for those signs of fatigue from the get-go. How you feeling?
Good.
Not too bad?
Yeah.
All right, good. Go ahead and rest. All right, so start working our way up a little bit more. We'll go into some of the other bigger primal movements. Squat and deadlift are the two big ones. And then we'll also start throwing in some balance portions. Unilateral balance. Great way to test people's abilities to hold themselves up, flexibility and strength of the muscles. So squat, when I'm giving somebody an assessment on a squat and a deadlift, two huge things when it comes to overall fitness of the glutes and the hamstrings and the quads, like we talked about with those bad habits of sitting all the time and keeping those muscles stretched and deactivated. I'll ask them to do their best impression of a squat for me. So go ahead and do your best impression of a unweighted squat.
Okay. Is it bad to move where my feet are?
Nope, go ahead, make yourself comfortable. And come on up. One more time. And come on up. So not bad, not bad. A couple of things that we can address, especially with somebody who isn't quite of your skill level and educated, is when we're unlocking our joints, positioning the body, positioning of the joints in relation to other portions of the body. So knees to toes is a big thing, right? We always learn about knees to toes. So what I'll typically ask clients to do, unlock the hips first. You're going to thrust your glutes back like you're sitting back in a chair and come back on down. Pause, and then come back up by squeezing the glutes. People are usually going to be going all quads, so you want to look to them and say, hey, pause at the bottom, let's activate the glutes. By pausing at the bottom, we're taking out the elastic component of the muscles so much, letting the various components of the muscles relax, shut down, and then reactivate. So we're reinforcing that neural connection from the top down. So let's go ahead and give that a try. One more squat, unlock, sit back, pause, and squeeze the glutes to come back up, nice and slow. One more time. And come on back up. And this is usually the part where we start to reinforce what we've done previously. So come on down, one more time. All right, now squeeze those shoulder blades back together. Yeah, keep those going, and come on back up. Outstanding, good job. All right, relax. Kind of a superset would then be to go into the deadlift, depending on the fatigue level of whoever you're working with. You could go into the deadlift, which is going to get a little bit more glute work going, or you can start going into some unilateral balance. She's pretty fit, so we're going to go into some deadlift. Go ahead and give me your best impression of an unweighted deadlift.
Just a regular deadlift?
Just a regular deadlift. Good. Now how about a stiff-legged version? There we go. So bending at the waist, coming up nice and slow. Good. Just got a pretty good impression of it. And that highlights the two ways that we can go with it when you're working with weights. You'll frequently see a bent leg deadlift. But more commonly, people are going to be just bending at the waist when they're working around their everyday habits. So I'll frequently ask people to do an unweighted, bending at the waist, stiff-legged deadlift. How far can you go down? Not everybody's going to be able to go down and touch their toes, but everybody's going to be able to bend over to some degree. So when we're doing that, we're looking for total range of motion. So why don't you come on straight down and pause. So this is her breaking point, where we see that lordotic curve start to break down the low back. That means that this is the point where she's losing the flexibility in the hamstrings. They're tight. She's having to arc the back in order to go down further. Come back up nice and slow, squeezing the hamstrings and the glutes. So several iterations of that are going to allow us to really open up the hamstrings and the glutes, see what the real true range of motion is after you got some good blood flow and elasticity going on there. And you can up that up just by adding weight and seeing what their upper limits are. But that's going to really start to light up the glutes when we ask people to activate those glutes, because typically people are just bending and coming back up. Bending, arc in the back, and come back up. What happens when we ask them to pause, squeeze the glutes, Bring them up using those larger muscle groups. From here we can start going into some unilateral balance stuff. Typical stance we'll use for this is called the stork stance. Balancing on one leg, palms out, chest up, chin up, and scapula retracted. The purpose of this is to look at the strength of the lower leg altogether, but also find discrepancies in balance. That's the other big portion of finding new information about a client in an assessment, is figuring out where their imbalances are. That's what we're always going to see. Somebody's right-handed, somebody's left-handed. They're going to predominate with one side, they're not going to use the other, or they're going to use one for other tasks. Typically you'll see a lot of dexterous activity used with your dominant hand, so fine motor skills like writing or typing or picking up smaller objects. Meanwhile, you're going to use that other side for carrying heavy stuff. So sometimes you'll see people are a little bit stronger on their non-dominant side, but a little more dexterous with that dominant side. So I'm going to have you go ahead and take up that stork stance for me. Let's start with your right leg. Palms out, chest up, chin up. Squeeze the shoulder blades together. All right. So this is a pretty good example of what you'll typically see. We've got a little bit of hip height coming up on the left, and that's a means of compensating for a little bit of imbalance with that glute medius. You step one forward, get back in the frame. There we go. A little bit of discrepancy with the glute medius strength. And she's compensating for the extra weight that's being held up by the left side by arcing to the right. So what I'll have clients do is then tip the waist. Now we're getting back on our center axis and ask them to balance just like so. So what do you feel right now as far as how your muscles are working?
A little bit of hamstrings, a little bit of quads, a little bit of calf.
Okay. Now go ahead and unlock your knee and put a little bit of bend in it. There you go. Now what do you feel?
Mostly quads.
Okay, so that's the difference in how you orient the joints. Don't be afraid to, when you're executing a specific exercise, have them move their joints just a little bit, unlock the knees or lock the knees. You can have them come up and down on the calves. Basically, you're just trying to incorporate as much muscle action as possible from that one side, and then go to the other and see where you stand. Oh, that was funny. All right, let's go ahead and try the other side. Keep that chin up, looking towards the horizon. You feel any differences in your balance from this side versus the other yet?
Not really. Well, I corrected my hips this time.
All right, go ahead and unlock the knee. Pretty good. Go ahead and retract scapula there. There we go, good. Chin up, looking towards the horizon. Good. So we're basically reinforcing the skeleton being in that proper alignment, using those muscles to do the work. All right, good, relax. So that's a good example of where we start with the balance portion. We're getting those lower leg muscles working, we're getting from the knee up working, and you can combine those in any sort of fashion. If I have a client that's clearly fit, like she is, or any other client that's quite fit, I can have them start doing single leg calf raises. I can have them doing single leg deadlifts or squats. Any sort of combination that challenges balance with muscle fitness. And that's pretty much a principle that we like to work on here a lot, whether it's assessments or workouts down the line. Anything that you can do on two legs, you can make it harder by doing it on one leg. And it's going to challenge your brain to work that much harder, reinforce those neural connections. Cool? All right, so from there we'll get into a series of various pulling and pushing exercises. We like to use the free motion machine using cable pull downs to reinforce the strength of the lats, and the rhomboids doing rows and lat pull downs. Purpose of that being, go ahead and turn for me. This way? There we go, good. So if you're thinking about the structure of the back, biggest groups of muscles you got are your latissimus dorsi and your rhomboids. Rhomboids responsible for scapular protraction, retraction, and the lats responsible for this pulling down motion here, okay? You've also got your dorsolumbar fascia and the quadratus lumborum down the lower back, and that's the site of a lot of back pain that you'll see from patients that come in. Hey, I got low back pain. I got lots of low back pain. It's on the right, it's on the left, it's right dead center. It's going to vary here and there, but short of having some sort of actual skeletal defect, people can usually attribute that to some sort of muscle imbalance. They executed a movement that they were not totally strengthened for. they were prone to one side, people lean to one side all the time, and they go and lift with that other side and you get a muscle spasm. Christian talked a little bit about the difference of addressing a muscle spasm with stretching versus contraction. Well, this is a good point to do that. If I'm asking them to execute those deadlifts and hamstring stretches with using actual active muscle contraction, well, now we get the lower back contracting. Oh, hey, my back doesn't hurt so bad anymore. And that's just in a single assessment. But if we continue that pattern down the line, we're going to see a lot of great results. Similar thing we're talking about with that front curling. A lot of people used to using those anterior muscle groups. You get a lot of front curl. When we ask those lats and the rhomboids to do a lot more work, we're pulling them back. So in the initial assessment, we're highlighting those specific differences, and people who haven't really experienced that kind of fitness in the past, they usually notice a little bit of a difference right off the bat, but it'll take time and repetition to get that really reinforced and build those habits. But when somebody is not able to actively contract a muscle group that's as big as the lat dorsi, that's like saying I can't curl my arm. If you think about the size of the bicep versus the size of the lat dorsi, it's easy to curl your bicep. And you don't have a great amount of muscle tissue there compared to the lats. So we should realistically be able to actively contract a muscle as big as the lats and even as big as the rhomboids in order to maintain overall good posture. So when I ask a client, hey, can you contract your lats? And they say, what? What does that mean? What's a lat? How do I do that? Well, if you can't flex it like your arm, you're not using it, which means we need to build those habits and go through a series of exercises to show you how that muscle is supposed to function. Make sense? Okay. You can go ahead and turn around, relax. So with special populations, I said we would start out on the table with a normal individual. We will eventually progress to working out on the table. You mind if I borrow this table real quick? All right, go ahead and lay down on your back.
That way?
Good.
It's all right.
All right, yeah, you're good. Okay, go ahead and lay flat, extend your feet out. Slide this way a little bit. So we can go through a series of exercises here, again, to emphasize strengthening and activating the posterior chain muscles. Go ahead and bring your feet up, bend your knees at about 90 degrees. Good key exercise for this is a simple hip raise or back bridge, depending on where you come from, how it's called. So go ahead and execute a back bridge by contracting your glutes and raising the hips up as high as you can go, and hold it there. So in this configuration, we're asking core to work, we're asking glutes to extend up and isometrically contract and hold on there. See how we feel. Just hold it for about 10 seconds. See how you feel. Feel those glutes working? Mm-hmm. All right, good. Number of ways that we can increase the difficulty on this, like I said, with a fit patient or a client. You can go ahead and have them extend one leg out. So go ahead and lift that leg out and hold. Now we're incorporating quad action in there. If I have her then raise up on the toes on that leg, well, now we're getting some calf action there. I'm going to reverse that around, go either way. A little bit harder?
A little bit.
A little bit. Okay. Go ahead and try it on the other side too. We don't want you to fall out of balance. There we go. Go ahead and hold. And go ahead and relax and lay down. People will typically go into an exercise like this thinking about the major muscle groups that you're working. So like we said, we're working the glutes as the primary worker there. But I can ask any client to activate the smaller muscle groups just with small, fine motions. So go ahead and reassume that configuration. There we go, raising the hips up. Now I want you to go ahead and press your hands down into the table as hard as you can. I want you to come up on your toes. Press your head into the table. Okay, how much more muscle do you feel like you're activating right now?
A lot more.
A lot more, right? So by pushing the hands down, we're getting the triceps working. By pushing the head back, we're getting all the upper back muscles working. And just pushing the shoulders in as well to stabilize from the hips down. And then we got the calves working. We got the hamstrings and the quads helping to stabilize. And the hip flexors are isometrically contracting as well to make sure that the hips are staying locked in place with the glutes. Cool? All right, go ahead and relax. Plank. So complementary exercise to the back bridge, the plank. Go ahead and take in this normal plank position. So in the plank position, amazing amount of muscle work we got going on. You're working your triceps and your shoulders holding in place, working the forearms as you're gripping and holding in place. All the core muscles, the rectus abdominis, transverse abdominis, hamstrings, quads, even the calves are working as you're holding the feet, preventing the feet from moving around. So insane amount of muscle action we got going on with this exercise. It's one of my favorites to use. And the golden number that I'll typically shoot for is 90 seconds, a minute and a half. If somebody can hold a plank for a minute and a half, we're doing really great. You're going to see extremely reduced likelihood of having any sort of low back pain because of the strength of the core muscles in the low back associated with being able to hold that configuration for that long. And I've seen people come in, be able to hold it for 10 seconds, and that's it, and they're winded. But through a few iterations, a couple days, it starts to go up significantly over the long term. I've seen quite a bit of positive nature come out of people being able to just do a plank normally. Because really, you're asking your body to hold a normal configuration against gravity. Because that's what we're pretty much getting at, with the exception of the arms being out in front. You're asking your skeleton to stay in line, which means you're using all of those muscles that we want to activate and hold the skeleton in line to do that. Cool? All right, you go ahead and relax. Go ahead and have a seat up. So that runs through the main component of the typical assessment for a new client. We've worked all the major muscle groups. We've asked a lot of balance to come into play. And really, it's going to come down to you as a trainer from there. You're going to build your own flavor after you observe for a while and mimic what you see from the experts. Then you'll start to develop your own flavor over time and be able to recognize certain cues that will prompt you to go one direction or another depending on how that client is responding and what their typical preferences or habits are. So that pretty much puts it in perspective for you, and take it and run down the line. You guys got any questions? No? All right, good.